Taking aspirin as a preventative measure may do more harm than good for some patients. A new study suggests people who have not already had a heart attack or stroke should not take a daily aspirin to prevent them. It showed daily aspirin users suffered a variety of long-term side effects, including stomach and intestinal bleeding. The study also tested the effectiveness of fish oil, which has also been sold as a way to ward off heart disease. While fish oil had no major side effects, the study did not prove it has any significant benefit either. For more on this, I want to bring in Dr. Shoshana Ungerleider. She works as an internist at the California Pacific Medical Center in San Francisco, and she joins me now from San Francisco. Doctor, thanks so much for being with us. Tell us about the findings of this study and what they mean for people who are at risk for heart attack or stroke but have not yet had one.
Thank you, Elaine. You know, the jury is really still out on whether people who are at moderate risk of a first heart attack or stroke should take a daily aspirin to lower their risk. And as you mentioned, these are according to the results from the ARRIVE study, which is a randomized, double-blind, placebo-controlled trial, which was presented at the European Cardiology Society meeting yesterday, and then also published in The Lancet, a peer-reviewed medical journal. So I think it's important for people to understand what aspirin does. So it's a medication that works to prevent the platelets, which are found in large numbers in the blood, from clumping and clotting in the blood vessels, really to improve blood flow to the heart and to the brain. And specifically, you know, the data that you are referring to is this ARRIVE study that I mentioned, and that looked at the use of a daily aspirin on heart attacks, strokes, and bleeding in a group of people that are at moderate risk for a first-time event. So this means they haven't had a previous heart attack or a stroke, but they do have some underlying risk factors. And what they found is that people in the study who took aspirin tended to have fewer heart attacks, particularly those aged 50 to 59, but there was no effect on stroke. And as you might expect, the rates of bleeding in the gastrointestinal tract and then some other minor bleeding events were higher in the aspirin group, but there was no difference in what we call fatal bleeding events between the two groups.
Well, what about those who have suffered a heart attack or stroke?
I think it's really important to note, thank you for asking, that the benefit of aspirin for preventing a second event in patients with a previous heart attack or stroke is well established. So this is just for the use for preventing first events that's controversial, with conflicting results in previous studies and with the main unintended side effect, as I mentioned, being bleeding. So if someone were to have a fall or get a bleed in their head or the GI tract, these can be hugely detrimental.
And specifically, what do these new findings mean for people who have diabetes?
So for people with diabetes, these folks are already at higher risk of heart attack and stroke. But a study presented found that the modest benefit that aspirin gave was actually offset by a greater risk of serious bleeding. So it's one of these trade-offs that's really important that patients discuss directly with their doctor about.
Now, is aspirin then safe for survivors of heart attacks and strokes who are already taking prescribed blood-thinning medications?
So sometimes that's the case. What I would say is there's so many medications that are used for people who've had a previous event, a previous heart attack or a stroke. Sometimes doctors use aspirin as an adjunct therapy, meaning on top of another medicine that thins the blood, and sometimes not. So that's sort of on a case-by-case basis, and people should be talking to their doctors directly about that.
What about fish oil? Should people continue to take fish oil since the study was not able to identify its effectiveness in preventing heart attack and stroke?
So based on another study that was presented, the role of fish oil for reducing the risk of a first-time event isn't clear either. And it's possible that there doesn't seem to be a big effect for fish oil supplements for prevention. So the jury is sort of still out on that as well.
So the bottom line here, for people who are wondering, what are some better alternatives to aspirin if, in fact, they fall into that group that you say, where the risks could be, in fact, greater than the benefits?
Well, what I'll say is that the takeaway is that no national guidelines at this point have been altered. So people on aspirin currently should not stop it without talking to their doctor. And then the decision on whether to start using aspirin for protection against cardiovascular disease should really be made in consultation with a doctor, considering all the potential risks and benefits, and especially for older adults in whom taking aspirin to prevent a first event is more nuanced. This should really be an in-depth conversation about the risks, their goals and values in the context of other medical problems. And we can't forget that there are other things that help reduce your risk of heart attack and stroke, like eating a healthy diet and exercising regularly.
All right, some good guidance there. Dr. Shoshana Ungerleider, thanks so much, doctor, for your time.
Thank you.